Traditional territories upon which we live and learn are steeped in rich Indigenous history and tradition. It is with this statement that we declare to honor and respect the past and present connection of Indigenous peoples with this land, its waterways, and resources. I would ask the clerk if we could take a roll call, please.
Thank you, Warden. Chair McLean has provided notice. Councillor Guardhouse?
Here.
Councillor Hawkins?
Present.
Councillor Little?
Here.
Councillor Nix?
Here.
Councillor Post?
Present.
Councillor Wrench?
Here.
Warden Horner.
Present.
Thank you.
At this time, or at any time during the meeting, members may declare pecuniary interest. Please state the interest and general nature thereof. Declarations must be verbal and in writing and can be emailed to the clerk. Number 5 is question period. Do we have any questions that have been submitted? No, we don't. And there are no members present from the public. And there are no delegations and presentations. But our first item, we're going to ask for the medical priority dispatch system implementation. Our first report is from Chief Paramedic Gary Staples regarding this implementation. Welcome, Gary.
Thank you, Warden Horner. Just going to get set up here. Okay. Good afternoon, committee, and I'm happy to be here presenting the medical priority dispatch system, which will be the new triaging tool that our communication center will be implementing later this year. In this presentation, I'm going to go through the current state, the current dispatching system that we operate with. I'll discuss the medical priority dispatch system, some of the benefits and some of the challenges with this new system, what to expect, not only from the public when they're calling 911, but also for yourselves when you see us responding in a different manner than what you might be accustomed to. And then finally, I'll kind of highlight some of the next steps that's going to take place over the next 10 months, moving into the implementation date. So our current system is called the Dispatch Priority Card Index 2. This is a system that was created in Ontario, only used in Ontario, and it's not evidence-based, nor is it actually efficient. Our code system has 4 codes. Code 1 is a deferrable. This is really a non-emergency transfer, usually from one facility to another. Code 2 is a scheduled transfer, which is basically a booked appointment. Code 3 is prompt, and code 4 is urgent. When someone were to call 911, basically the triaging tool would only prioritize the call as either code 3 or code 4, and that does not allow for much flexibility for ensuring that we can get to the most acute patients in a timely manner. Currently, the tool prioritizes 70% of all calls as code 4. So when it's at the highest category, we obviously can't defer for a call that might be more acute at the time. With this system, we are required to send the closest ambulance to the call, regardless of what their status might be. So they could have already completed their shift and are just returning on overtime, and they would still have to go to that call because they're the closest ambulance. So some of the challenges, kind of discussed a little bit already, but the over-prioritization. So when a majority of our calls are coming in as code 4, even if another call comes in that does sound to be of higher acuity, that ambulance cannot be deferred even if they're closer to that call. So they have to continue on with the first call, and then the next closest ambulance would be sent. So we're not able to separate low acuity patients. So Again, that over-prioritization doesn't allow us to go to the most acute patient timely. It also doesn't allow us to get into some of the operational pressures, such as breaks and meal times, end of shift. So we're going to all of these calls regardless. A lot of them we know are low priority, and we're still going no matter what. So the Medical Priority Dispatch System, it's a structured emergency dispatch system that allows us to get responders to the right patient at the right time with the right resources. So this system is internationally recognized, it's evidence-based, and it ensures that the sickest patients receive timely care. So the system that Ontario decided to go with was a 5-priority, that's common everywhere, but they went with the color system. So purple, which is our highest priority, is obviously a life-threatening event. Next would be red, so this is emergent or potentially life-threatening, and it's only these 2 priorities that we respond to with lights and sirens. Orange, yellow, and green are our lower priority calls. They are obviously not life-threatening and are not time-sensitive. In this program, they have acceptable thresholds for waiting, so a call can wait up to a certain length of time before there would be any perceived detriment to a patient. So like I mentioned, it's an international system. It's used in 58 countries and has over 29 languages. Currently, it's used in Ontario. Toronto and Niagara have been using this system for over 20 years. They are independently operated outside of the Ministry of Health, and that's why they've been able to use that system for such a long time. Mississauga Dispatch Center, which dispatches for Peel and Halton Region, implemented this in 2023. And since then, they've been moving across the province in the northern areas, Timmins, Thunder Bay, and they're kind of coming back towards our area very quickly. So what can we expect? So we're going to see a significant reduction in the number of times that we go out with our lights and sirens on. Anywhere from about 40% of the time. So that's a pretty significant drop. This is going to help us to improve our response times to the sickest patients. So those that we know that really require timely care are going to be able to get an ambulance first. And it's not going to be just based on the you called first, so we're coming to you first. There will be a potential increase in wait times for those lower acuity patients, but I'm happy to say that that normally is not a situation that we experience currently, and so that most likely would not happen in the future. We'll also have more ability to manage the operations of the day, so ensuring that staff get breaks when they need their breaks and aren't doing low acuity calls when their shift is over. Finally, one of the biggest pressures that we're not going to affect us, but it will affect our friends at the dispatch center. They are going to be on the phone a lot longer with callers. So when people are calling into 911, they are going to have more questions. Our dispatch center will also have the ability to provide more recommendations or what people can do to actually treat their conditions. So currently that's very limited, where someone calls in with chest pain, they may be recommended to take aspirin. This would expand as we get into the MPDS system.
Excuse me, Gary, so where is our dispatch right now?
Our dispatch center is in Cambridge. So the Cambridge dispatch does Waterloo Region, Guelph, Wellington, and Dufferin. No problem. So some of the benefits. So like I mentioned, better call prioritization. So those, the sickest patients that we see are going to get the ambulance first. We'll be able to balance workloads. So Currently, if an ambulance is driving back from the hospital, they're typically the closest to the next call, and they would continue to get that call even if there's a crew sitting at the station. So those lower acuity calls, we can try to help balance to make sure they get some breaks throughout their day. System optimization, so we're talking there more about the end of shift overtime, so making sure that even though there could be calls for sick people after shift, it's really, prioritized correctly to make sure that they're only going to the ones at the end of shift that they really need to be at, and we're able to send another crew when appropriate to make sure they can get off on time. Importantly, public safety. So the less that we go with lights and sirens on, the safer the public is. And that's really important. I've done some research, and across the county, we would see about 3 minutes is the difference between us going lights and sirens versus not. Now, it is a little bit because of Orangeville, having a higher call volume, so that would bring the average down. But typically, that's what you would see approximately. Our cross-border calls. So the way it works now is that if we receive a call, lights and sirens, we would respond regardless of what jurisdiction that call is in. So if we are determined to be the closest, we would go. So that would continue. But with the new system, because there's going to be a larger number of calls that are not life-threatening, the municipality that services that area would be required to do that call. So we would only go into Peel Region if the call was determined to be a purple or a red. And finally, the ongoing innovation. The system that was created for 911 for ambulance wasn't designed for what we're doing now. So there is a lot of patients that are calling with non-acute, non-emergent conditions, and they don't all need to go to the emergency department. Some places are actually not even sending ambulances anymore. So this system will allow us the ability to start progressing down to that. So like I mentioned, some of the challenges will be the delays for the lower priority calls. Peel did experience this when they did switch, which did result in a number of complaints just because of the fact that those low acuity calls were waiting, all within acceptable timelines, but the public just wasn't aware. And finally, the higher workload for our communications officers, so they will be on the phone a lot longer. Those low acuity calls that are waiting are required to be followed up on a regular time interval, and they can be up triaged if the condition changes. So our timeline, so we have launched. We've started our introductory meetings with the Ministry of Health and our communications partners in January. We will be working with our team internally to develop our response framework. And then once we finalize that, we'll be doing some staff training later this fall with our implementation date of December 10th, 2025. So what's going on? So we are doing some public awareness. So we have connected with our Headwaters Communications as well as county, and we're going to do a broad communication out to the public to try to make sure as many people in our community are aware of this change. So we're meeting regularly with the Ministry of Health, our communication center, as well as the organization that created this tool, Priority Dispatch, and we're just working together to try to figure out how we get this kind of response framework put together and how we ensure that our patients are getting the timely care. Communication with our stakeholders. So you guys are my first. I plan on communicating with the municipals, so lower tier municipalities. So should you guys wish to have me come and present and speak about this, I'm more than willing. Also have spoke with our fire departments and they are aware of this upcoming change. The hospital has been notified, and the police department as well. A little later in the year, the Ministry of Health will be doing presentations to our hospital and fire and police partners. We'll be working on our response matrix and deployment plan starting in May, and hope to have that finalized early June. And finally, the implementation of December the 10th. So in summary, our most critically ill patients will receive care first, which I think we can all agree that is the most important thing. Non-urgent calls may have longer waiting times, but as I mentioned, typically hasn't been what we've experienced here, and I don't foresee that being an issue moving forward. Our dispatchers are going to require more details and more time on the phone, which will ultimately lead to better care. And finally, our implementation date of December the 10th. And any questions?
Thank you, Gary. So, Councillor Nix?
Yeah, Gary, when you say this is an evidence-based system, what's the evidence? The information the call center's getting? Is that the evidence you're talking about?
Yes, through you, Warden Horner. So this organization has been around for a very long time, and what they do is they take all of this information and map it out with patient outcomes. So they have a very good understanding of
what information? The information that's being phoned in?
Yeah, so when the caller calls in and says, this is what my complaint is, so they take that information and base it on what the paramedics find when they arrive on scene, and then they map it back to the outcomes when they're transported to hospital.
And if I could, these people who take the calls, are they trained medical people? I mean, if I phone in and say I got a chest pain, they know what I mean, they're trained. They're not just answering the phone.
Through you, Warden Horner. Yes, they are trained. They have to go through significant training to be employed. And with this new system, they do have to go through at least 24 hours of emergency medical dispatch training.
So if I really wanted an ambulance, I would lay down on the floor and start screaming and holding my chest and telling them that I'm okay. I'm just, sorry.
You'd be lucky to get an ambulance. Anyone else? Anything? Councillor Post?
Thank you, Warden Horner. Just a quick question. Because we're using the Cambridge call center, when we change, does that mean that every municipality that uses Cambridge call center will be using the same system? So everybody at that call center will be utilizing this system now?
Through you, Warden Horner. Yes, so all three services will be going to MPDS at the same time, and we're all working together to create a response matrix that is aligned.
Councillor Guardhouse? Okay. Anyone else? Yes, Councillor Nix.
Percent, I think mainly of males are colorblind. I just wondered, I mean, have you checked your drivers just to make sure they can see these colors?
Fortunately, we don't have to worry about them seeing because they're told which color to go. Yeah.
Thank you. Gary, I'm trying to figure out, so a lot of the time we get the complaint that, okay, fire, police, and ambulance all showed up at the same time, at the same incident when paramedics didn't need to be there or police didn't need, whatever. So this is going to cut down on that. Is that what the ultimate goal would be, that if you didn't need to be there, you wouldn't be there?
Yeah, I think we will find some efficiencies with especially sending our volunteer fire departments to calls that they don't need to be at. That additional screening that our communications officers will be doing will help to reduce the number of times that the fire department is dispatched. And for us, it's really not going to change. We're still going to come. And then police is usually an automatic dispatch for a certain criteria of calls.
So you're suggesting this is going to be a real benefit to our fire services in cutting down the number of calls that they won't have to be at?
In my communications with the fire department so far, I have indicated that there will be a slight
Oh,
decrease.
slight, okay.
I'm not exactly sure of how many, but I do see that there will be a bit of a decrease for them.
Guy?
All up, I had the privilege of phoning dispatch, and I was very impressed with their response and how they took the time to say, what do you need? And in my case, it was just fire. There was nothing else, and that's all that showed up. And they, once again, I have to admit that they wanted to keep me on the phone to make sure that everything was good and there was no changes in that. So this is going to even improve what they're already doing, but they were already being proactive on that point. We don't want everyone showing up if not necessary. So.
You have a hand?
You're cutting in and out, but I'm assuming everybody's looking in my direction, so I'm going to talk now. Oh, yeah. So the first thing is I think we found our new Anna McGregor. You've got a lot of acronyms in here, which is great. But it did take me a while to get through them all. So if you're going to do these again, could you maybe make some sort of glossary or something so that they're easier to follow? Tiered response was on my list of questions to ask, and you've sort of gotten at it. That would be kind of handy. The number of ACOs, that's not really in our jurisdiction, but it sounds like they're going to need more. If you could talk about that and if these people exist.
Yeah, so that doesn't have really anything to do with the paramedic service. Our ambulance communication officers are employees of the Ministry of Health. So they have noted that they will require more time on the phone with callers and following up. And so they haven't shared if they will be adding additional communications officers in Cambridge. But my experience is that they have noted that there will be a higher workload. So I would hope that the ministry is going to proactively try to find additional staff.
Okay. And lastly, I wonder if, and I don't know if it's easier to give a hypothetical or to just give what happened to me and the way I live my life will probably happen again. If I'm writhing on the floor with a broken leg, where does that fit into the tier now?
It's hard to say, honestly. I don't actually, I'm not the owner of the tool. That's more of our dispatch friends. When we get into that, I would have a better idea. But typically, severe pain would be an indicator to triage a call versus somebody that's just lying on the floor and not able to get up. So if you had a broken leg, it would probably be a higher category than someone that we're just going to help lift up off the floor and put back in a chair.
Probably depends whether your bone is sticking out, Phil.
No, I don't think so. I think it hurts a lot. Actually, I know it hurts a lot either way. So I've done one. I don't want to do another, but it is what it is. That's very comforting, though. Thank you.
Okay, no further questions. I'll take a motion that the report from the Chief of Paramedic Services entitled Paramedic Services 25001 Medical Priority Dispatch Implementation February 27th, 2025 be received. Moved by Gail, seconded by Guy. All those in favor of this report? Carried. Okay. I'm going to turn the next 7.2 over to Brenda, and she's going to give us the quarterly community services activity report for the fourth quarter 2024.
Thank you, and through you, Warden Horner. As presented in the report, it really highlights all the activities that have occurred over the last quarter of 2024. Some of the highlights in there is that we were able to house 11 applicants, 9 in county buildings, 2 in some of our housing providers. Early years and childcare, they transitioned over to a new cost-based funding around CWELC. And we also had 2 new providers that opened as well during that time. And Ontario Works, things remained fairly status quo around case management, but we were working at that time towards transitioning towards a new model with the province with centralized intake, and that'll be discussed further in one of the other reports. Just wondering, in that, were there any questions with some of the information that was shared?
Phil's got a question.
There we go. Thank you. Where was the homelessness? I was going to start there. So we have more individuals experiencing homelessness, but less chronically homeless, which seems a bit of an oxymoron. And I wonder if you could provide a bit more context there, Brenda.
Thank you. Through you, Warden Horner. Absolutely, there's 2 classifications of homelessness, those that are deemed to be chronically homeless, and then there could be those that are homeless for a night or 2 here and there. They would all be classified under homelessness. So that's where you're seeing the difference in the numbers there.
Okay. And then if since I'm here, client outcomes exits to employment. That's, in my opinion, again, another good news story. It seems to be trending in the right direction. Do you have any indication of why that is? Like I've been here for a while and it used to be in low single digits, and now we're getting into the mid-teens. That's pretty good.
Through you, Warden Horner, to that point, I think we need to do probably a bit more of a data deep dive. That's a third party that actually does the employment service, so we haven't been able to receive that information yet. But I think it has a lot to depend. It depends on what's happening out in communities, who's hiring. Like there's so many pieces to that. So between that and then also, of course, monitoring who comes back. I think those 2 numbers there are something that we need to look further into.
Okay, thanks, Phil, for your question. Anyone else? Okay, may I have a mover and a seconder for the following motion that the report from the Director of Health and Human Services, Health and Human Services 2025-008, Quarterly Community Services Activity Report, 4th quarter 2024, dated February 27th, 2025, be received. Moved by Lisa, seconded by Fred. All those in favor? Carried. Thank you. All right, moving on to 7.3, Canada-wide Early Learning and Childcare, or CWELC, as it's often referred to, update number 5. Brenda.
Thank you. Through you, Warden Horner. I want to take this opportunity to introduce Sarah Lodazerto. She is our manager of childcare and early years. Asked Sarah to come today. She put a lot of work into this report and has been doing a great amount of work around the CWELC implementation, and had Sarah come along, of course, to maybe provide further information. We thought there might be some questions around this. But just as a highlight, as everyone's aware, we did report throughout last year that we anticipated that there was going to be a shortfall. And we wanted to bring this information to committee and then council just because we have a better idea now of what that's going to look like. And really, this is a 2-piece report. I see this as a good news story too, because we really were able to exceed our targets. And at the time when we were building those relationships with providers that were coming on board, it was something that we thought that maybe the province would be able to change their numbers. And at this time, we haven't been given that indication. They've spoken to that there may be some recalibration, but we haven't received anything in writing around that. So we just want to be cautious moving forward and, making sure everyone's aware that we could be looking at, as you'll see in the report, approximately a $2 million shortfall around this. And you may remember at budget meetings, we did ask for the surplus from early years in childcare to be able to put into the reserve in anticipation of this. And I also want to bring attention as well in the report. I think it was August 2024, they did shift how the funding was being applied. So it went from a cost-based model, it changed from a revenue replacement model to a cost-based model, which also impacted things. So that, in a nutshell, is basically the report. Just wondering if there's any questions.
Questions, Fred?
I can't find where you said it, but I know we exceeded our target, and that's because we had, a couple of new childcare places open up. Was one of them out in Hockey Village?
That one has not opened yet.
We've had some problems with that. Okay. I guess the other question is the $2 million. I can't remember, Brenda, from the budget. Does this exceed what we were anticipating in the budget? Is this going to put us over budget?
Through you, Warden Horner. I believe the surplus at that time that we were looking at was approximately $500,000 we thought we would be transferring over to the reserve, but we already had money in there as well. So at this time, until we know more what's happening with the province, that's, we're really looking at what's in the reserve right now. I don't have the actual figures in front of me, but I think it's around, Sonia, you may be aware, I think it's around 1.5. Yeah, it's around 1.5 million in there right now. And by September, if we haven't heard anything from the province, that would allow us an opportunity. We'll have a better idea of how we're operating within community services as well. Are we anticipating a surplus that, we could also maybe take a look at? And that's why we're only looking and asking for the one reserve right now. If we need to come forward to committee again, we'll be doing that, or to council at that time.
Okay, I guess what I'm thinking, Warden Horner, is in the back of my mind, does this affect how much of that surplus we were putting into the housing strategy? That's still whatever we left it at is there. Okay, thank you.
Anyone else? Question? It seems very strange to me that, we exceed what the province wants to do and we kind of get penalized for doing it. And I know the rules changed halfway through, but if they really want to make this work, you would think that we could make sure that we would be made whole here at some point so that we would continue to exceed the targets and certainly try to meet the need, which is what we should be trying to do. Yeah. Fred?
Did the province ever change that, the proportion that had to be for-profit and proportion not for-profit? That's my first part of my question. My second question is, are these total places we've got in Dufferin, how many are from for-profit childcare places and how many are for not for-profit childcare places?
Again, I don't have the number right in front of me, but our split is about 70%, 30. We are over our target for profit.
70% for-profit.
Yes.
And what was the provincial number that we had to?
I believe it's 70-30 is the provincial split.
Bill?
Thanks. Brenda, could you remind me, who provides the funding? It's mostly federal, I think I remember. Could you maybe just refresh my memory on that? And it goes through a bunch of different levels and probably gets siphoned off as it goes.
Through you, Warden Horner, and I'm looking at Sarah, so she's there to jump in and correct me if I'm wrong on this. It is federal funding, but it is administered by the provincial government.
Okay. All right, seeing nothing further, may I have a mover and a seconder for the motion that the report of the Director of Health and Human Services 2025-06, titled Canada-Wide Early Learning and Childcare System, CWELC, Update 5, dated February 27th, 25, be received, and that if calibration of the CWELC funding allocation to align with actual growth targets does not occur before September 2025, any shortfall in CWELC funding for 2025 be funded from the Children's Services Reserve Fund. Mover? Gail. Seconder? Guy. Any questions? All those in favor of that motion? Carried. Thank you. Okay, 7.4, the home ownership program update.
Thank you. Through you, Warden Horner. Again, this is a great program that's actually been around since about 2008, and it's the Dufferin County Home Ownership Program. And what it does is it helps low to moderate income rental households move into home ownership. The highlight of this report is what we're asking to do is to change one of the guidelines. Currently, this program is open to any renter in the province. And what we're asking is to have this move to Dufferin County residents specifically. And this is really to do some planning for the future. Right now, our fund balance is healthy, but we have noticed that majority of the applicants, and I believe it's the last three, like what we're starting to see, it's people coming in from other areas, which is allowed, but we want to make sure that this fund stays healthy. And also part of this program, what you really want to see is the ability to take a look at rental within your own area and being able to open up those rental spaces. So as somebody moves out and goes into home ownership, it's opening up a spot for somebody else. So that's the ask around this report, is the ability to just kind of narrow that down a bit.
Any questions for?
Any questions?
No, you do not.
I want to make sure, if I buy a house under this program and I live there for 20 years, the second mortgage is forgivable. So I don't know how much I would have paid off in those 20 years, but whatever the balance is after year 20, bang, it's a gift. I don't owe any money. I'm not objecting to that. I just, well, I did a double take when I read that. Strikes me as, I guess it's good. It's quite generous, I think.
Through you, Warden Horner. And that is, that's part of the guidelines that are provided to us. And it really is right now, it's a self-sustaining fund. So it doesn't impact the tax levy. It's, as I said, it's a healthy amount in there. And what happens for all those households that do sell their house and then move on, they do pay that money back, and there's capital gains on that as well. So I know the fund itself, the primary amount would then go back into that fund. So it's only for those that are within our community for 20 years that would be forgiven that piece.
Hopefully that's a lot of people.
Yeah.
Anyone else? Bill?
Thanks. Yeah, so I'm very much in support of this change for precisely what Brenda said. I mean, it doesn't make a whole lot of sense to, or it doesn't do anything to increase rental housing around here if people who are moving into home ownership aren't moving out of a rental in Dufferin County. My question was around all the other criteria. I don't know that we've ever talked about this, if they're set by the province. I think I saw that one person entered into one of these agreements, but I think that's the first one that I can remember since I've been on county council. And I'm just wondering, the cost of houses is high. To say that, it has to be below 610,000, that's really limiting the market. So I don't know My question in an open-ended sense, is there the ability to change other criteria other than this one?
Through you, Warden Horner, just so you're aware, I think it was in the last couple of years, we increased this to the amount that it is now, the 609,000. At one time, I believe it was 399,000. Some of the other municipalities have kept the price of housing low as well. Believe, I'll have to reach out to staff just to confirm this. I think we've went almost to the maximum that we can. Well, the guidelines themselves come from the government, so we base that around that. There was a little bit of flexibility about the gross current household income, but again, we always go to the max that we can because we do recognize, of course, that people aren't able to afford to be able to take part in this program. That there's definitely some restrictions in place. So we've tried to be as open as we can.
Are you okay?
Just on the how often has it been used? I kind of threw out what I thought. And that's unfair question of the day, but such is life.
Through you, Warden Horner, I know myself, I've signed 3 agreements just in the past several months, so it is being used. I think there was a bit of a pause for a while, just based on housing prices. We've had to wait for those housing prices to start to come down, so we're starting to see that, so we're starting to see some movement.
Thank you, Brenda. Okay, could I have a mover and a seconder then for the motion? Moved by Lisa, seconded by Guy. That the report of the Director of Health and Human Services, Health and Human Services 2025-05, titled Home Ownership Program Update, dated February 27th, 2025, be received, and that staff be directed to update the current eligibility requirements for the home ownership program to be restricted to residents of Dufferin County. Any opposed to this motion? Seeing none, that motion carries. 7.5, changes to the Ontario Works.
Thank you. Through you, Warden Horner. This is an information report to share an update with our Ontario Works division. Effective, we found out it was early February, late January, that we were going to be moving over to the centralized intake with Ontario Works applications. So we knew it was coming. They started off with, I believe it was 10 service providers, and they're starting to move out to other service providers. So it was our turn. So effective February 18th, this came into place. What's happening is province taking over centralized intake. We're still doing the initial determination of applications as it relates to around emergency assistance, temporary care assistance, and then those under the age of 18, any of their applications. And we're also continuing to provide that ongoing case management. So staff are still busy. We're just starting to see, I guess it's week 2 that we've been in this new change. So we'll learn more as we go along, but just wanted to share that information with you on that change.
Councillor Nix?
Does this have any impact on staffing for the county or our budget? Does it lower the amount of staff time we need?
Not at this time. There's been no change to funding, and as I said, staff are still working with all our folks. So as we learn more, we'll be sharing that.
Bill? Oh,
Yeah, thanks. No, this has been going on for a long time, from what I can remember. And I think the question has always been, how is this better? And I'm pretty sure nobody has the answer to that. But I guess we'll see.
Through you, Warden Horner, I absolutely agree.
anyone else? Okay, I need a mover and a seconder for the motion then. Lisa? Earl, I'm going to put you on this one, okay? that the report of the Director of Health of Human Services, Health and Human Services 2025-07, titled Changes to Ontario Works Program, dated February 27th, be received. Any opposed? Seeing none, motion carried. Okay, was there any correspondence? There was none. Any notices of motion? And there are none. Any other business for the committee? And as you have probably been told a time or two yet today, our next committee meeting will be the last committee meeting, and it will be March 27th, 2025. So bring cake, okay? Okay, I need a motion to adjourn. Guy and Gail. All those in favor?